Hello everyone, welcome to this lecture from CyberMD. Today we'll be discussing pressure volume loops and the cardiac cycle as it applies to cardiac physiology for the USMLE Step 1 exam. First, let's talk about the pressure volume loop. This is a graphical representation of the relationship between the pressure within the heart and the volume of the blood in the heart at different points in the cardiac cycle. This loop is divided into 5 main phases: isovolumetric contraction, systolic ejection, isovolumetric relaxation, rapid filling, and reduced filling. The first phase is isovolumetric contraction. During this phase, the ventricles contract and the pressure within the heart increases, but the volume of blood within the heart remains constant. This phase is important because it helps to increase the pressure within the heart, which is necessary for blood to effectively be pumped out of the heart during systole. At the end of this phase, the aortic valve opens. The second phase is systolic ejection. During this phase, the pressure within the heart is at its highest, and blood is expelled from the ventricles and into the systemic circulation. This is the phase during which the majority of blood is pumped out of the heart. At the end of this phase, the aortic valve closes. The third phase is isovolumetric relaxation. During this phase, the ventricles relax and the pressure within the heart decreases. However, the volume of blood within the heart remains constant. This phase is important because it helps to decrease the pressure within the heart, which is necessary for blood to flow back into the heart during diastole. At the end of this phase, the mitral valve opens. The fourth phase is rapid filling. During this phase, the ventricles quickly begin to fill with blood as diastole progresses. However, the volume of blood within the heart is not as high as it was during the previous diastolic phase. The fifth and final phase is reduced filling. During this phase, the ventricles continue to fill with blood in preparation for the next cardiac cycle. However, the rate of filling slows as the volume of blood within the heart reaches its maximum for that cardiac cycle. At the end of this phase, the mitral valve closes. It's important to note that during the cardiac cycle, the pressure within the atria and ventricles change at different times. This is the reason for the distinct shape of the pressure volume loop for the atria and ventricles. The pressure volume loop is a valuable tool for understanding the mechanics of the heart and how it functions to pump blood throughout the body. As we discussed earlier, the pressure volume loop is a graphical representation of the relationship between the pressure within the heart and the volume of blood in the heart at different points in the cycle. The loop can be affected by several factors, including contractility, preload, and afterload. First, let's talk about contractility. Contractility is a measure of the strength of the heart's contraction. An increase in contractility leads to an expansion in the pressure volume loop upward and to the left, resulting in an increase in stroke volume, or the amount of blood pumped out of the heart with each contraction. The increased contractility also increases the cardiac output, which is the amount of blood pumped by the heart in a given period of time. Next, let's talk about preload. Preload is the amount of tension on the heart muscle fibers before they contract. An increase in preload leads to an expansion in the pressure volume loop upward and to the right, resulting in an increase in end-diastolic volume, or the amount of blood within the ventricles at the end of diastole. This increase in preload also increases the stroke volume, which is the amount of blood pumped out of the heart with each and every contraction. Finally, let's talk about afterload. Afterload is the amount of resistance against which the ventricles must contract to pump blood out of the heart. An increase in afterload leads to a shift in the pressure volume loop upward and to the right, resulting in a decrease in stroke volume. Due to a decreased stroke volume, there is an increase in systolic volume. This decrease in stroke volume can lead to a decrease in cardiac output and an increase in myocardial oxygen consumption. In summary, the pressure volume loop is divided into 5 main phases: isovolumetric contraction, systolic ejection, isovolumetric relaxation, rapid filling, and reduced filling. It can be affected by contractility, preload, and afterload. Thanks so much for watching, and remember to subscribe to our content.